Many times patients with asthma are given a peak flow meter to help monitor their asthma. In studies, patients that manage their asthma by monitoring their symptoms have been shown to do as well as patients who use peak flow meters. So I don't use them very often. But there is a small percentage of patients who do well with monitoring. Those are mostly the patients who have been out of control long enough that they're having a hard time telling when their asthma is starting to give them problems. Once we have them under control long enough and they start feeling what normal is again, a lot of times they're able to feel and sense their symptoms long before their peak flows start to drop, and we may not need to use the peak flow anymore. What's more is you want to make sure that you don't look at a normal peak flow when you're having symptoms and go that, oh, peak flow is okay, so we don't need to do anything. Peak flow is not necessarily one of the first things that goes down, and so trust the symptoms as well. But if you're using a peak flow meter to help, there's a few things that you need to know. One is it is entirely effort dependent. So if you are not giving your best effort, it's a worthless test. So when you do that, what you want to do is make sure that people are standing up straight, that they have the peak flow in a straight line, and that they are giving their absolute best effort. They need to lock their lips around the mouthpiece and completely and give one quick blast. So it's okay. It's not like we would do when we're doing pulmonary function tests. It is one quick blast and you're done.